The history of dentistry stretches back to the distant past, and new discoveries are forcing us to reconsider conventional wisdom. A museum in Guatemala houses an artifact that has caused quite a sensation: a Mayan molar, estimated to be between 24 and 30 years old. A green stone, likely jadeite, one of the most prized materials in Mayan culture, is carefully set into the center of the tooth's chewing surface. At first glance, this may appear to be a decorative element, but a closer examination reveals that the stone is firmly set so as not to interfere with chewing. This rules out a purely decorative purpose and points to a therapeutic intervention. Scientists note that previously known Mayan dental practices primarily concerned anterior teeth. They were decorated and inlaid, creating a striking appearance. But in the case of the molar, we are dealing with a tooth hidden from view, and this changes the picture. The stone was likely inserted into the damaged area, replacing it with a kind of filling. Thus, the ancient Mayans cared not only about beauty, but also about health. This discovery was an important step in understanding the medical knowledge of Mesoamerican civilizations. Jadeite played a special role in Mayan culture. It was a symbol of strength, wealth, and spiritual energy. It was used in rituals, jewelry, and ritual objects. But the fact that the stone was used to treat a tooth speaks to practical knowledge and the ability to combine the sacred with the utilitarian. Perhaps the procedure itself had a dual meaning, both therapeutic and ritual. The person who had the stone inserted could have been a member of the elite, as the use of such a valuable material for medicinal purposes indicates high status. A macroscopic analysis of the tooth revealed that the procedure was performed during life. This means the person survived the procedure and continued to use the tooth. The internal structure indicates a mature age, 24 to 30 years. In the context of that era, this was an age of strength and maturity. This discovery raises questions about the extent of Mayan medical knowledge. We tend to think of dentistry as a product of modern science, but the facts speak to the contrary. The Maya understood that dental health was essential for survival. With limited resources and harsh life, tooth loss could be a serious problem. Using jadeite as a filling was not only a symbolic act, but also a practical solution. In a 20-minute story, the context of this discovery can be shown to the viewer. We are transported to the jungles of Central America, where Mayan pyramids rise. Archaeologists carefully extract artifacts from the earth, and history comes to life in museum display cases. The camera zooms in on the tooth, revealing a green stone glowing in the center of the chewing surface. A voiceover explains, "This is not jewelry. This is healing."
Next, we delve into Mayan culture. Jadeite is a stone valued higher than gold. It was mined, processed, and turned into amulets and ritual objects. But now we learn that it could also serve medical purposes. This discovery changes our understanding of civilization. The film could show a reconstruction of the procedure. A person sits, a Mayan shaman or healer prepares a stone and inserts it into a tooth. The atmosphere of the ritual is combined with the practical purpose of maintaining health. The camera shows how the stone fits snugly into the chewing surface without interfering with jaw movement. Then the story expands. We talk about other dental practices of ancient peoples. The Egyptians, Romans, and Chinese all had their own methods of dental care. But the Mayan discovery is unique because it involves a precious stone inserted into a molar. It's not just a treatment, it's a symbol. In the final part of the film, we return to modern times. A dentist picks up a modern filling and compares it to jadeite. The difference in technology is enormous, but the essence is the same. Humans have always strived to maintain dental health. Thus, the 20-minute script becomes a fascinating journey from ancient artifact to modern knowledge. It reveals that the Maya were not only pyramid builders and calendar makers, but also people who understood the value of health. Their knowledge of dentistry was deeper than we thought, and it is now becoming part of our shared history.